I'm Dr. Craig Escudé, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
The IDD Health Matters podcast is a joint production between Friends for Life and Electability. For more information, go down into the show notes and click the link where it says Learn More Here.
Welcome to this episode of IDD Health Matters. Our guest today is Dr. Ben Warner. Ben, welcome.
Thank you very much.
So, Ben, you have a fascinating background with lots of education and experience. A lot of it related to healthcare for people with intellectual and developmental disabilities. Tell us about yourself.
Well, I've always had an interest in taking care of people. So for me, I really wasn't sure how I wanted to go about doing that. So as a kid, I volunteered at the hospital. And volunteering at the hospital, I found myself just, whenever there was a need for somebody to move a patient to the x-ray department, I would volunteer to do that. And if it was something else at the lab, would someone run something over to the lab, I'd say I would do that. Well, then that eventually moved on to me becoming a nursing assistant. And so the same thing happened. I would be working on one of the floors, say the medical unit, and they'd say, well, someone called in sick and we're short on staff over in reverse isolation. I go, I'll do that. So I was my way of learning about all the different areas. And so I sort of went into college and knew I wanted to do something in healthcare, but I still really wasn't sure how I wanted to maybe take care of people. I wasn't sure how I wanted to go about doing that. I ended up in graduate school, working on a master's in neurophysiology because I thought, physiology, that's how things function. I'll learn how the body works. And then that led to meeting someone who was a dentist that I got to know them better than my own dentist I was going to. So that led to dentistry, which then just, it continued.
Yeah. But you didn't stop at dentistry.
No, I didn't. I didn't. I met this guy in dentistry, went into dental school, practiced dentistry for 10 years. But once again, still the desire to do the best I could and to help those patients I felt had the greatest needs. So the person that comes in and they're pretty healthy and they have a toothache, that's pretty straightforward. The patient who has hypertension or poorly controlled diabetes, or they have some kind of intellectual disability, or they have some physical limitation, they have a little bit more difficulty. They have a little more difficulty just getting into the building. They have more difficulty getting from their wheelchair or their walker into the dental chair. So all of those things were of interest to me because I felt I could do more. So what ended up happening after practicing dentistry for 10 years, I had my own office. I decided I needed to do more. And I went in and I told my wife, I said, hon, I think I need to do something else.
And she's like, oh no.
Well, actually, what was really interesting, I was afraid she was going to be not too supportive of me. And in fact, it was the exact opposite. She says, hon, I know you've been thinking of something. I'm just not quite sure what it is. And I said, well, I believe I want to go to medical school. And she said, well, okay. But the thing was, she said, I know if you don't do it, you won't be happy. And if you're not happy, I'm not going to be able to be happy with you. So let's do whatever's necessary.
That's wonderful.
She was very, very helpful. And she knew I wanted to do something even before, quite frankly, I did. So I had my office. I was running the office. I was very, very fortunate that I had a lady that was at a dental. She was my associate. And I asked her, I says, well, would you mind seeing my patients during the week? And then I will come in on the weekend and see the more difficult ones, the ones with more complications. And so that's how I started medical school. I went to medical school, the typical morning to evening, Monday through Friday. And then when Saturday rolled around, I would go into my office at 6 o'clock and I would see patients from 6 to 6. And by the time we closed up the office, it would be 7 o'clock. And I remember when I would finish medical school that week, I'd go through Monday through Friday. And when Friday would come, I would go, oh my gosh, I've got to go to the office. I've got to go to the office on Saturday morning. Why can't I just sleep an extra hour later? But the funny thing is when I would come home late at night on Saturdays, I actually had more energy than that morning. And that's how I knew I needed to do what I needed to do. I would go to medical school during the week. I would be very tired, just like any medical student. Sure. And that's what it is. I mean, they make the reference to it's like trying to drink from a fire hydrant. Mm-hmm. And that's what medical school is all about. And that's exactly what it was for me. But what helped keep me motivated was what I saw on Saturday. I would see those patients and I felt like I really can make a contribution here. And so I'd go back Monday morning, I'd start it all over again, and Friday would come up and I go, why am I doing this? This doesn't make any sense. I can be with my family. I remember one time we were all sitting around at the table, and my wife is a teacher as well. She was in the elementary school teacher. And we have 3 children at that time when I was in medical school, and we would all study. My wife would be at the dining room table. She'd be working on her lessons plans, and each one of the 3 kids, which were about 22 months apart, they were in elementary school, and they were at their different levels. They were studying at the table. And of course, I had my textbooks for medical school. They were out there and I was studying. And one day, our youngest daughter came home because her only experience was me being in school. The other ones had seen me at the office a little bit. And so she came home one day. She had been with one of her friends at a sleepover. And she said, Mommy, how come her friend's dad, he doesn't go to school. He doesn't have to study. She thought all families were like ours, that we all sit at the dining room table. Yeah. And we did more than just eat at the dining room table. We all studied at the dining room table. So that's what I did. I went all the way through medical school that way.
So that certainly prepared you to take care of very complex situations, people with complex conditions. Is that what led you to work with people with intellectual and developmental disabilities?
Yes, it was a natural extension of the desire to help. One of the things that parallel that is, I've been out of dental school a couple years, and I put in my own office. And when I put my office in, I moved into a brand new multi-story building. That building was filled with physicians, 3 stories of physicians that were all well established, but had moved into the new building and were beginning to do new networking. Mm-hmm. I happened to be on the first floor. I was the dentist in the building. And so when they had a patient that was kind of complicated, and maybe the local area dentist who had a full practice would say, I don't really have time for this person who has extra needs requiring extra time. I was in the building. I was convenient. It was something I wanted to do. It just happened.
So we're coming to you from the AADMD conference, and where are we? Chicago.
Wonderful. Yes, Chicago, yes. Windy City.
Yep. And you play a role in that organization as well, too.
Yes.
Yes. Can you talk about that a little?
Oh, the AADMD is a great organization. I got involved in it several years ago. They had a meeting actually in Houston at the dental school that I was teaching there with, and I started helping out. I did a few lectures on what I was doing that paralleled AADMD, and I realized that a lot of what I was doing was what AADMD was doing as an organization. So I became involved in the organization, and it has slowly led to more involvement in the organization. So now I'm on the board.
Yep. So, and AADMD.org is where you need to go if you want to find out more about the organization.
Please do. Excellent.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support.
So it's 3 and 3 time. So 3 tips, 3 words of wisdom, three things that you would like the audience to know that you think can improve health, wellness, supports and services, whatever, for people with intellectual and developmental disabilities.
I think the most important thing for me is that we all need to realize that we're patients. No matter what our background is, we are all patients. And so the thing is maybe today I'm not sick, but guarantee you tomorrow I will be. It's just a matter, it's life. So we all need to work together to improve healthcare, whether we feel like we're a recipient now, whether we're a provider now, whether we have whatever our role is, we need to make sure that healthcare is provided to everyone. I think my number 2 item would be that we need to be conscious of the person, those individuals who have the greatest needs in healthcare. Because if we take care of the person with the greatest need, the rest, the people who don't need this much, they're going to be taken care of automatically. And one day, we don't seem to get any healthier or younger with time. So the thing is at some point, we're going to be one of those people that has the greater need.
Yep.
And let's take care of those with the greatest needs, and the rest of us get pulled right along with it.
I like that.
So
do you have a number 3?
Number 3. Well, the thing is I believe I've always felt that it's important to serve. If you're serving your fellow man, you're taking care of everything. It's very difficult when you look at situations, and I've always felt that the other person doesn't have it as good as me. I think I am blessed in the sense that what difficulties I've been given are ones that the Lord felt I could handle. I look at other people and I look at their difficulties and think I couldn't handle those, but somehow they managed to handle them. So I think if we all work together and cooperate, that's the key thing.
That's a beautiful, beautiful thing to end on. Ben, great talking with you. I love the work that you do. I'm very appreciative of all of that. So thank you again for taking the time to talk with me today, but really for the incredible work that you do in this
thank you.
field.
It was a pleasure talking with you as well. So
good to see you.
Thank you.